Hello, Scott, and welcome to my YouTube channel, Jumping Detox. I'm very happy to have you today because when I was having an interview with Linda Nelson from Melissa Test in London, she told me about you, and I had the opportunity to have a conference from you in London a few years ago. I think it was in 2018. So welcome, Scott.
2018. Yeah,
2018,
thank you
yeah.
very much.
And before
Appreciate it,
COVID,
Nick.
and yeah, it was quite interesting for me because I'm very passionate about dentistry, but very focused, on the mercury intoxications for the patients. And I learned at this time that there is consequences also concerning the other metals in the body. And so perhaps you can have a short presentations of yourself and why you start to be involved in this particular field.
Right. Well, I'm a physician and surgeon of the foot and ankle. And so over the years, I've inserted thousands of metallic implants into my patients. And then probably about 15 to 20 years ago, I started noticing other effects, not just local effects, but systemic effects that I didn't even realize occurred. And we've never been trained on this in our medical training, in our surgical training. Nobody talks about this. I mean, all metal allergies are rare, and really don't have to worry about it a whole lot. And at this point, I very much disagree. I think it is much greater than we have, and as a medical community, have any idea of what's really occurring. And just a second, I got something up to oop. Can you still hear me?
Yeah, I still hear you.
And it says something about conserving my language speaking. It says French.
Yeah, me too. So you just cancel it. I think
Okay, sorry about that. Sorry about that. Okay, it's a Zoom thing or something. So,
yeah.
All right. So anyway, yeah. So many years ago, there was a patient, a young patient. I remember her specifically, and she was in her early 30s, and she had two children, two daughters, 8 and 10. And she came in, and she was just going, "Oh, I can hardly button my blouse, and I can't open a door with one hand. I have to use two hands to open the door." And she goes, "I'm getting very concerned about being able to take care of my daughters because I'm just declining physically, with this." And I had operated on her. I put two stainless steel screws in her foot, and I took them out. Next day, she comes back in but next day she could button up her blouse just fine, open the door handle just fine.
Yeah.
I mean, boom, gone.
Yeah.
And this was going on for months, and so then, and I really didn't put it all together. I go, "Oh, that's interesting," and then the next year I operated on her other foot, and what do we do? It's kind of before we really started using titanium as much. And so I put stainless steel screws, and same thing happened. And then same thing happened when I got them out, because in my field, vast majority of the time, once the bone's healed, I don't need the screws anymore. They're just sitting there doing nothing.
Exactly.
Other than potentially causing problems. So that kind of went on. And then there was another case that came on. It was a gal who very prominent in our community. And I had put titanium plates and screws in her in May. And she liked to wear dressy shoes and what have you. So, and they're kind of prominent. So we were planning on getting them out later that fall. While I was going in for the pre-op to get the screws out. And the staff comes in and says, "Oh, she's not in a very good mood, just giving you a fair warning." So I walk in there and I go, "Well, what's going on?" She goes, "Oh, since about June, I don't know what's happening with my body. I'm just tired all the time. I can hardly move my neck at all. I can hardly get up from a sitting position. I've been to 3 different doctors. They don't know what's going on. They're going to send me over 3 hours away to a bigger area specialist to see if they can figure out what's going on." And so anyway, so I end up getting the titanium plates and screws out, and she comes back in, and her foot was hurting her too. And so I go, "Well, how are things going?" And she goes, "Oh, the foot's great." No, I go, "How about everything else?" And she goes, "Oh, it's all gone." And this was, 3-4 months later, that just essentially overnight, all these aches and pains, and move her neck fine, went away. So I just really started, after that case, started looking closer at it, trying to figure out, why, and just really asking a lot of questions. Because why would, so, I'm putting things in the foot and ankle. Why would I ask about headaches, migraines, neck pain, other pains in the body, fibromyalgia, chronic fatigue, and all this? And and sure enough, the more questions I asked, the more I found out. If you don't know what to ask, then you don't know. And that's where it kind of came about. And then I started looking at the first case that really came about with me, that I started connecting actually the foot and the mouth, was a patient of mine. He was an engineer, and he had toes that were curling. He had neuropathy from his knees down. And he wasn't diabetic, but he was like a diabetic, where the nerves affect the muscles, they innervate the muscles. And then so there's an imbalance to that. And each toe has 8 tendons that come to it. So anyway, his toes were curling. He was getting infections at the tips of his toes. We tried everything conservative, didn't work. Okay, I got to straighten these toes out. But also he had pre-ulcerative lesions right behind the second and third toes, like a diabetic would. So I was going to have to shorten those bones. And I used 2 stainless steel screws in each of those metatarsals. And I had pins in the toes, which I subsequently took out. Anyway, he got better, did great, no more problems with the tips of his toes. See you later. Came back 4.5 years later, and his big toe now was curling. But then he ended up having swelling over where I had these screws. And I was going, oh, does that hurt? And he goes, well, no, my neuropathy now is extended over my entire body. And my entire body, and I can stick myself with a pin in my side and I don't feel it.
Yeah.
And I go, that's weird, and so, okay, well, let's get these screws out, because that's not normal. And then I have to, actually fuse the big toe, and I was going to use titanium in the big toe. Do all that. And he comes back. Actually, it was the second visit. It was about 10 days later he came back, and he and his wife, just the greatest, happiest couple in the world. But he comes back and he goes, okay, doc. And he's an engineer, and he's going, being the engineer that I am, I started looking at when I started getting all these metals in my body. And I didn't know what had happened with this gentleman at this point in time. But so he said, I got I had amalgam fillings placed when I was a kid. And then I had 2 gold crowns placed later on. And then I had an ACL repair in my knee with a titanium screw. And then you did surgery on my foot, on both feet actually. And you put those stainless steel screws in my feet. He goes, I didn't put it together right then, but 3 months later, I started developing episodes where my whole body would become paralyzed. I could not, I could breathe, but I could not move. I was totally rigid. I couldn't talk. And it started at 45 minutes, then it went to an hour a day, 2 hours a day, 3 hours a day, and ultimately 10 hours a day. He was paralyzed, could not talk, disabled, couldn't work anymore. He went to University of Washington. They did all kinds of genetic studies, went to Mayo Clinic here in the United States, and they couldn't come up with anything other than, described his condition and as episodic rigid quadriplegia. And he goes, then you took the screws out of my feet. Overnight, I went from being paralyzed 10 hours a day to 3 hours a day. And then, so I go, okay. And so I knew what I was going to do at that point in time. Then I sent actually Dr. Stetskal, Vera Stetskal was still alive, who invented the ELISA test at that time. And I had been working with her already back then. And so I contacted her, and she said, well, send the blood over, and I'll do it myself, And so sure enough, sent it over, and he was highly allergic to nickel. He was allergic to nickel, but then highly allergic to palladium. And his gold crowns were 26% palladium in his mouth.
Okay.
And that was the first thing that kind of correlated me between the metals in the body and then the metals in the mouth. And he also had amalgam in the mouth, And so we ended up then, I knew he had a plan. I said, what's your plan? So, okay, we ended up having to get the titanium out of the foot also, but then he got the titanium screw out of the knee, and then worked on getting I got all the amalgam out, and then the gold crowns out. The day he got the last gold crown out, he hadn't been paralyzed since.
Okay.
Yeah. And his ELISA test for palladium was like 129, with anything above 8 being highly, highly reactive. So that's what really put me between, I started looking between the foot and the mouth.
Wow.
And then later started actually figuring out a way. I felt there was potentially a galvanic reaction going on between the two. Just because when I removed the metal from the foot, and that's after I put the metal in the foot, that's when he started being paralyzed. But then I took it out and he wasn't completely paralysis free, right? He
Yeah.
wasn't paralysis free. It wasn't until he got the gold crowns out that he was finally paralysis free.
Yeah.
And so I was going, something may be going on here. So anyway, that's when I started testing galvanically between the foot and the mouth.
Wow.
And testing between the stainless steel or the titanium that I was using, and then all the various dental metals
You were the first.
that were.
You were
What's
the
that?
first one. You were the first one in US to do this kind of test, because those tests, I suppose, were exist. So did you invite it, or did you find people or tools to
Oh,
test it? How did you do it?
yeah, no, I knew nothing about anybody in the world doing those tests, between the foot and the mouth. I don't know if there still is.
Wow.
I've never heard of it. But then actually it was later where we kind of came up with this article of Lebedev out of Russia in 2011,
Yes.
who then he did a very similar study. Actually, it was a much bigger study where he was looking. Yeah, here's the article. It was in Human Pathology in 2011. And they were looking at the pathologic or toxic actions of metals in the human body and the role of galvanic currents in its formation. And this is almost perfectly in line with what I was seeing. And in his particular study, he talked about the millivolts and the U max, he called it, and he was looking at the burning sensations with galvanism in the mouth.
Okay.
And okay, at what level between these metals, because some people have multiple metals in their mouth and no burning sensation, but others do, right? And so they were looking at, okay, at what level of the millivolts do you start seeing this pathologic type reaction where you start getting symptoms? And now I didn't know anything about this at the time. I was just looking at, okay, how can I measure some of this millivolts? And actually I talked to a neurologist in our local town who I knew, and I said, can I borrow some of your equipment to kind of look at, test between these metals that I take out of the foot or ankle and then the mouth? And he goes, well, actually it's going to be best, better than that is going to be getting a real high quality voltmeter and utilizing that. And then, one of my challenges was figuring out how to sterilize the probe, in the sterile wound in the foot. And so I worked with the hospital and they're in our central sterilization people, and they go, just take a probe, a cautery probe, that's already sterile, cut off the end, put the plug you need for your voltmeter into that. And then you have that end, the sterile end. I go, okay, that's great. So that's what I started doing.
Wow.
And so some of these, and I'll show you what we kind of did in regards to that with some of these tests, because I started looking at all kinds of various, like I say, the various metals that we tested and that type of thing. And so like in this particular case, I tested between a gold crown. Okay. Let's see if here's a gold crown in the mouth. And then I went ahead and tested between this particular patient had a titanium screw in her toe where I straightened her toe out. Okay. And so there's the cautery probe in the toe and the OR.
Okay.
And then now, according to like the action potential of a nerve, and I don't know the relationship between that yet or not, but action potential of a nerve fires off at around minus 55 millivolts, and the resting potential of a nerve is 70 millivolts. And I don't know how this corresponds between up and down at this point in time. But then in Lebedev's article, he talked about he calls it a U max, which kind of the threshold, at least in the mouth, where things are in closer proximity, where something will cause some pathologic changes. and he had minus or 50 millivolts was the threshold that he found in the mouth. And so this then, in this particular case, when I tested between the two, she was, 300 and some odd millivolts between the foot and the mouth.
Okay.
And so, yeah, so in that particular case, so then I started looking at the other various metals that were going on. And yeah, here's this one, maybe here's the gold crown.
Mm-hmm. Yeah.
And then here we go. And 228 millivolts
Okay.
change between the two. And then after getting it out, and then just testing to the like in that last particular case, it was a titanium screw in the foot.
Mm-hmm.
And then I got it out and then tested to the bone.
Okay.
Oops, sorry.
Yeah.
Tested to the bone,
Uh-huh.
just to the bone. Okay.
Okay. Okay.
And then the millivolt change was 30.
Oh. Boom. Okay.
Yeah.
Okay.
And that's in line what he's seen in one of the tables that I sent you, the one where there's normal values and the normal values and then the pathologic values, but in the normal values,
So this one.
yeah. So yeah, this is it. Yep. Oh, actually, the normal one this is good. This is good.
It's good. Okay.
So yeah, on the left-hand side of that, you see 0 to 80, and that's millivolts, okay? And when somebody has no metals in their body, what they found, they're between, the averages in there between 30 and 40 millivolts.
Mm-hmm.
And when somebody has one body or one metal, then it's, 60 to 70. Okay. And then two or more types of metals, then it's up in the 70 to 80. But these were, I believe, this is more, no real pathologic issues. These are kind of, average values. And then if we go to the next slide, we'll start looking at the pathologic values that they found.
Let me see, because I think I don't have the next slide. I have just the focus of pathological action of metal on the human body. And I just
that looks like
I just have this one, but you can share. You can, if you find it, you can share on your side if you want.
Yeah. Okay. Yeah, I can send that one, and yeah, I believe this is it. So yeah, I will send that to you. And
you can send it to me, and during the interview, we can go back on the new one.
Sure. Yep. So anyway, I just sent it to you. But so what they see with that then is, and I don't know if we can see it here much or not, but
okay,
but
okay,
yeah, that one, yeah, that came. And so what they're finding, and which was quite interesting, because that's what I feel I am finding also, and
the quality, it's quite difficult to read because it's just pictures. But anyway, I will put on the interview link to find everything about that, so it won't be a big deal.
Okay. Yeah, just what it kind of looks like, perfect. And again, it is. Yeah, but yeah, so there's kind of, I think it's one dental prosthesis, and they're looking at just on this column here, on this column. Okay. They're looking at the various findings with the millivolts, and as you start getting other metals in your body, they're finding increased values. Wow. And increased values just in the foot or in the mouth itself. Okay. So they're finding increased values of the testing in the mouth when somebody has a different metal or other metals in their body. Okay. And so which indicates a reaction between the metals and that are in the body as well as in the mouth.
Exact. Okay.
So, and then with pathologic values, again, they were getting up to, 150 millivolts, but that's in a close proximity. So I'm all the way down to the foot when I'm looking at that. And when I took a couple metals out of the body, a titanium plate and a stainless steel plate, and had them close, and I actually presented that to the FDA back in 2019. I presented the FDA on the systemic effects of metal allergies. And so, but it was like 400 and something millivolts with just ultrasound gel between the two. And then I ran it down 6 feet on a Hot Wheels track. And then the voltage was less, but it was still like 118 millivolts, 6 feet away.
Right.
And so, and that's before I started doing any of this testing. And when I presented the FDA, it was before I started doing all this in vivo testing. So, my feeling and how this I feel is important is then you look at galvanic pairs. So and you're looking at amalgam, okay? And a lot of these patients that I find these significant symptoms of, many of them have amalgam fillings. And I want to share one with you. And then I talked to these patients about, the amalgam and issues with amalgam. And because amalgam, as you know, excuse me.
Yeah, I have to say to the listeners, I have to say to the people that don't know you, I remember during the conference that you bring with you few testimony case, and you record it, and I think you have a huge amount of testimony. And this was quite surprising me because for when I'm looking a keynote speaker during this kind of conference, okay, there is a lot of theoretical speeches, but you let the patients talk, and I think it's what we are going to listen now. Okay.
Right.
Let's
Yeah.
roll.
So, and this one, yeah. This was one that wasn't too long ago. I put titanium plates and screws in her. And again, she had some amalgam fillings in. But so this was some of her symptoms, okay, after we got things out, well, before and after. So let me just have you listen to her.
You feel like
Just a second.
I have right foot surgery with titanium plates and screws. And just recently, this last week, we got the plates and screws out. And prior to that, what did your body feel like?
Since June, I have been experiencing all over body pain, fatigue, joint stiffness, and then nerve pain in the foot and going up the leg to the back.
And what about your focus or?
I've been in kind of a brain fog since the surgery. I thought it was the anesthetic for quite a while, but 4 months later, it really hadn't worn off much. I wake up in the morning and I feel like I haven't rested at all. I get home at night and I just can do nothing because just going to work has been enough, and it's just been mentally taxing. So.
And since getting the hardware out, what have you been feeling?
The first thing I noticed when I went home was a lot of energy and feeling like I just was thinking clearly. Other than the local pain from the surgery, the overall body pain was gone. My back pain was gone. The nerve pain is gone. The aches, the joint pain, all gone.
All right, thanks.
Yeah.
So that's the type of stuff that I'll see.
Brain fog, always when I had patients with mercury intoxications, the two symptoms are brain fog and a lack of energy. And that's why I'm really concerned about how to bring all those knowledge, and thank you today to be with us, because I'm working with dentists, and I hope, and I don't know what happened in US, and I hope that the biological dentistry field is more advanced, but I think that a lot of dentists don't have a clue about electrogalvanism. Yes, they have a clue about electrogalvanism between the gold and the mercury because it's common sense. but there is no link and no question about if they have other metals in their body. And I think it could be a very an enormous it would be fantastic that the dentist would have no more knowledge about this field, you know, about what you say.
Right, right. And it's all, and you know, we're still, obviously there's always more research that needs to be done. This is our findings that we'll be presenting. We haven't written this article. We have a number of articles to write, but we're in the process of that. But and then some of these findings, but it's like I say, it's in line with the Lebedev, you know, article and what their findings were. And you know, and what it's always kind of said is that two metals need to be touching to have a galvanic response. But you look at just, I mean, just common sense
with the saliva,
because
it's common.
Yeah. Right. You have the saliva, and then it's an electrolyte solution. Okay. And then what you need, you need for galvanic response, you need dissimilar metals. Okay. You need two dissimilar metals, and you need them to have a potential between the two, a galvanic potential between the two. And there's a galvanic chart. Okay. That's like gold is one of the most noble metals. And then titanium is up there, and stainless steel, and amalgam is down. Amalgam's down here more. So then you have these galvanic potentials that have already been figured out for us, you know, with the engineers, galvanic engineers over the years. So we already have the table. So we know there's differences between, let's say, titanium and amalgam. Okay, we know titanium is more noble, amalgam is less noble. And then, and if we have a galvanic, you know, pair, and then what we need an electrolyte, okay, which in the mouth you have the saliva, but you also need, and in the body we have all the interstitial fluids and all that, but then you need to transfer electrons, okay? So you need the fourth thing you need is to transfer electrons. Well, okay, if you have just a simple static shock, you go and rub your feet on the carpet in a dry, you know, environment, and then you go to touch a doorknob that's metallic, what happens? You transfer the electrons from the ground through your body, you know, out your fingertips.
Exact. Yeah.
Yeah, that's how you transfer electrons. And same thing in the body. So now you have metals down in the body, you have metals in the mouth, or, you know, various metals in the body. And then in my mind, you know, it just only makes sense that you're going to be transferring electrons. And yes, it's going to be very slow. It's going to be slow, but these metals are in the body for years, you know, and then you start seeing some of this galvanic, you can start seeing galvanic corrosion going on. One of the other studies we have going on right now, and is that of, it's an explant study where we're using corrosionists or corrosion engineers are taking these metals and placing them under electron microscope and then breaking the metals down, you know, ion by ion to figure out the percentages of the metals and all that. But this particular gentleman was in New York, and he had a back surgery with titanium plates and screws. Totally disabled him. I mean, he wasn't able to work anymore, barely able to function. He was actually committed to the psych ward a couple times. And he wants to get his story out and all that. But anyway, we have his explants. And then here is the titanium. And this is the plate. This is what it should look like with the striations. And here's all the corrosion that occurred.
Wow. Okay.
So, and I mean, where'd all those ions go?
Exact.
Well, they're in the body.
So that's why the immune system is just reacting like hell, I think.
Oh yeah.
Yeah.
Oh yeah. And he's allergic to nickel, and you know, all titanium alloys have a trace amount of nickel. And that's the thing, you know, it's been told a lot of times to people out, you know, titanium is, is nickel free or, you know, more biocompatible. The problem is what we're seeing with a lot of these patients, because I have people contacting me from all over the world, and I work with scientists and doctors from different parts of the world. And they, I presented at a toxicology conference via Zoom, you know, over in Turkey. And then one of the cardiologists got a hold of me afterwards after he heard this talk. And he's going, well, he was working on writing papers on stents, you know, because they're putting stents into people, but it's metal. And if you're allergic to it, you can have problems, you know. So, and again, not everybody, respond or reacts, but there's a percentage of us that do. And that's what we need to be aware of and find out. And that's where, you know, we're advocating, if you're going to put some type of metal permanently in a body, you know, you should be testing for that ahead of time.
Yeah, this
You
is
know, and patch testing only does so much. It's a dermal reaction, hapten type response versus the like the ELISA test and you know, lymphocyte transformation type tests that look at the lymphocytes, and the reactivity and the of the lymphocytes is really what's happened, I believe, in the body. And I've been very pleased with those tests and what they've been able to just guide us to. Even the gentleman who was paralyzed, I had no clue that, you know, that he had a problem in his mouth. You know, and that test directed us straight to his mouth, straight to where the part of the problem was. Then he could get it addressed. And I've seen that many times, you know, with those tests where it directs us right to where a problem is. And then, oh, you have this other metal. And we're seeing problems with metal clips, you know, from thyroid surgeries, gallbladder removals, because a lot of them are endoscopic, you know, gallbladders, they're going in, but they're clipping them with metal clips. And these patients
yeah, we
don't have a clue.
We don't have a clue about how thousands of health solutions we have, but with metals. So like you said, it's people are sometimes just have, and it's also a question about hypersensitivity, because it's not because you have a huge amount of metal that you are going to react strongly. It's sometimes you just have a little bit of a screw. I remember in London when you told that it was just a question about one screw. So for the people with
that was one of the that was one of the cases. And then also the reactivity between the metals, and that's that I'm finding more and more also. And that particular case was actually one I was just sharing because another patient she got a hold of me through somebody, and yesterday I was having a Zoom meeting with she and her husband, and so a similar type thing where she had also amalgam fillings, and then you know, had other hardware looking at getting a total knee, and that one, the one case that we were talking about is kind of, like I say, really kind of shows how we can have some of these different pain. So here she is here. Let's take a listen to her.
So you had hip replacements. When was the first one?
The first one was 2000. They were both in 2014. They're just 2 years old, and they were 4 months apart.
Okay, and then after the first one, did you have many problems with the hip?
The first one I did not. As soon as I had the second hip put in, I had major changes. First, personality, food issues, rashes, and then the chronic hip pain started in.
Okay, and then what are these hips made out of?
These hips are titanium hips with a ceramic ball.
Okay, and then you had actually surgery on your foot in a single stainless steel screw approximately how many years ago?
That was in 2001.
Okay, and so then just looking at your issues, we decided to, get the screw out of the foot. And that was a couple weeks ago.
10 days ago, yeah.
10 days ago, okay. And so what have you noticed? What are some of your symptom changes you have noticed since then?
Oh my gosh. And it's not just me noticing it. It is family members, coworkers, etc. I can actually turn my neck now without having chronic neck pain. I have not had a headache in 2 weeks. My personality is a total 180. I smile. I'm happy. I get accused of drinking way too much coffee because I'm excited about life. I'm not depressed. I don't cry. I have energy, and I'm a changed woman. 100% changed.
All right, neat. What about then your hip pain? What do you notice there? What kind of pain did you have since the hips, when they started hurting? What was the pain like? What scale, on the scale of 1 to 10?
Okay, first off, I'll say about a few months after the second hip was put in, I went on pain pills. And my pain level was always between a 4 and a 7. and I'm talking every day, 7 days a week. And I have not taken a pain pill since after surgery, just due to my foot, hurting a little bit, and haven't taken one since. And I had zero hip pain at this point, zero.
Oh, okay.
So yeah, but yeah. So on that though, what I'd heard actually when talking to Dr. Stepskull way back when, she was the first one that put me onto that, where patients would get like a total hip or knee, and they would just have chronic pain, but everything looks good.
Okay.
Everything looks good. Surgeon says, it's fine. It must be in your head or something like that, And so one of the issues though, she was seeing that they would remove like amalgam from the mouth and the hip or knee pain would go away. And I just gone, what?
Yeah.
But now that's what I'm seeing with a number of these patients. And I have a number of them, recorded where
it's hope. It's really hope. It's when I listen this kind of testimony, those pain, those chronic illness, and people don't have a clue about what is the sources. We are not saying today that the methodology to see about metal allergy is the only way to do it, but perhaps we can start like with this. It's just classic blood test with a specific lab like the Melissa test, and with dentists who are able to make some safe removal. Let's see what happened next. And when I listen those testimonies, it's a huge amount of it's a hope. It's just fantastic because what she said, it's that she said that wow. Also the impact on the psychology about about the brain, and it's quite fantastic. So I think it's a huge field that we need to explore more and more, and hands to hands with the dentists, with the doctors, and so thank you to do all this for them, and I think you have big fan.
Yeah, well, thanks. Yeah, and that's the thing too. We all get kind of in our own little worlds, Here I am, foot and ankle down there, and then the dental. And so I presented this last couple of years to the International Academy of Ceramic Implantology.
Exactly, I saw that.
And yeah, and but they're going, this is great, having an orthopedic type guy talking to us. Number one, why are you here, right? And but then after they hear me talk, and then they're going, oh, it makes them start thinking about things, and I think we all need to work together. And I think, like I say, we get in our own worlds, I mean, the dentist, the orthopods don't talk to the dentist. They don't talk to primary care docs even a whole lot, and or the, they do to, for certain things. But this is one aspect where we all need to, be working together.
There is a reality, Scott. It's the price of all of that, because on the dentistry part, I think that sometimes it costs a lot, to have safe removal, to put to take out implants, or to not treating root canal, and all those debates. And I'm also very interested in how to explain to a patient that the investment is there, because it's in there for their health. But for an example, titanium hip costs a lot to change it, and the procedure, it's just a mess. You just have a new hip, and someone like you, say, yeah, but what you have, why you suffer, it's because of that, and we have the proof of that. So if you don't want to suffer anymore, you need to do something on your hip. So what is the cost of that, and how you explain this to the patient?
Right. Well, and then what I'm saying too is that it may not be, even though yes, you get the testing, okay, what type of allergies you have, but also I think you need to look at what other metals are in the body. Okay. So I'll give you an example of a gal who I had operated on. She had a back surgery with titanium plates and screws, and she just had, and then she had a total knee. And then after the knee surgery, the back pain got way worse, you know, just kind of like in the last case, right? Because titanium, yeah, just like the last case. Her first hip was okay. She got the second hip, and then she started having problems, you know. And so this particular patient, then she had her and she's quite a character. So you just she is quite a character. But she had this chronic then back pain, and I had operated on her years ago, as well as my partner, and put stainless steel in her foot. Okay, so and again, they are just similar metals. All right, and they're separated more on the galvanic chart. And so then I talked to her, and she was having back and to the point that, you know, and her surgeon said, hey, everything looks great, no problem, you know. And so then she we decided, okay, well, let's just see about getting the metal out of your foot and see if that helps your back pain, you know. And so I'm going to let you listen to her. Okay, listen to her. Like I say, she's a bit of a character, so just hang with us on this one.
Okay, about 4 years ago, you had some back surgery with some titanium hardware, correct?
Yes.
So titanium
Then
hardware.
had a left knee surgery with also some titanium.
Yes.
And prior to your knee surgery, what would you say your back pain was?
5 or 6.
Okay, and after your knee surgery, you feel it was how much?
10 to 15.
Okay. But then also, many years ago, you had bilateral foot surgery with stainless steel screws. Well, yeah, 5 different surgeries. And those are about how long ago?
Between 1993 and 2003.
How old is
Okay.
she?
And you always kind of had some residual pain with those?
What's that?
How old is she?
She's in her early 70s now.
Okay. Okay.
Yeah, yeah. She was and this again is one of the things where, okay, you may have a painful implant, okay, whether it's hip, knee, you know, something that can't be removed, right?
Yeah.
And then you really should, in my mind, from what I'm seeing, you should look at other metals in your body and look at getting these other metals out before having to, you know, and see if it's going to make a difference. Yeah, before you go to the big one, you know, the
You have
knee or
everything
hip.
in your mouth and the other ones.
Yeah, exactly. Get the simpler stuff out first. What's
Yeah.
best is if you have one metal in your body, you know, not 2.
Okay.
And that's exactly what the Lebedev article just showed. Also, you know, if you had one in, okay, you have 2, then you start having more of these galvanic reactions going on. Yeah.
Yeah.
So here is her then continuing on.
Is that correct?
Yes, especially if I stood too long at a time.
Okay. And then we recently got the screws out of of both feet. And how do the feet feel now?
They feel fine right now.
Okay. And then how has this affected then your back symptoms? What's your back feeling like now?
My lower back has no pain now compared to 10 to 15 prior to this surgery.
Okay. Thanks.
So that's what I can say. I mean, the back pain went away.
Yeah.
She didn't have to have the hardware removed from the back.
This is what I say. It's like a miracle. That's why people sometimes, I think, in the scientific field, they just say it's not possible, you know, because, you know, back pain, you know, there is a lot of factors, and there is something somewhere else to find a reason, you know. And when I heard this kind of testimony and about your work, it's just a miracle. And so that's why I think it's very important for the audience to know more about you and also what you bring on this topic. You know, it's fantastic.
Yeah, well, I'm always asking questions. I think you always have to ask questions, and we don't know it all by any means. And but I keep seeing this, and you have to listen to your patients. Yeah, because and once you start listening and understanding, okay, and now when I interview somebody who's been referred to me, that and I'm listening, and that's what I'm asking. Okay, what other metals do you have in your body? What other surgeries have you had? Well, I had a belly surgery. Okay, well, did they leave any clips? Well, I don't know. They didn't tell me about that. Well, then we get x-rays, and here's these clips around an appendectomy site, like the patient I just talked to yesterday, the gal, and then she had a cholecystectomy, where she had her gallbladder removed, and she has 4 clips there. And but those clips, I mean, and we have seen, I've worked with a number of those patients. They're not patients of mine, but I just help them, and just from we kind of work with some of the experiences I've seen and what have you. But then they get the clips out, and it's just life, and I mean, it's just life changing. When they have, and again, not everybody by any means. I mean, there are a certain percentage, and so that's where I mean, a lot of people do just fine with the different metal in their body. I mean, they do great. I mean, some of the best surgeries in the world, for quality of life, are hips and knee surgeries, right? So, but there are a certain percentage, and I think when there are issues with an implant of any kind, because I put, like I say, a lot in, and actually after my last 10 years of my practice, I took out over 1,000 implants in over 400 patients, just because I would give them that option at that point in time. I go, this is just, it's not doing anything at this point, and it could be irritating on shoes and what have you. And it was up to them if they wanted to get it out. And so, and I did a lot of procedures. So 400 patients over the last 10 years had their implants removed, with a significant improvement, even pain and swelling, just from the implant coming out. And I would say over 50% of those patients, just even right that next week, the swelling was significantly decreased. Not that they had any other symptoms at all, but the swelling, local swelling and discomfort just around that site was significantly improved. And typically I'd wait for bone healing. So it's maybe about 2 months or so, 2 to 3 months, before we get the everything out.
So it's my question was, what do you think about the titanium implants? But I think it's quite the same. That it's another metal, and again, it's if you have more than 2 or 3 different kind of metals, it's could be a mess, I suppose. Do you train dentists, or do you think that dentist or dental clinic could be interesting to be, to have a conference from you, because this is a part also that I want to bring in Switzerland. I really want to bring knowledge like the Huggins Grube protocol, and also all the knowledge that you have. Do you think, and perhaps you already did it in US, to train the dentist and to put in their anamnesis those questions about where they can find other type of metals, like strain, art, ankle, foot?
Right. I mean, if somebody asked me to lecture, I lecture. And like Sammy Nimbusi with the International Academy of Ceramic Implantology, I met him actually through Linda. When I presented the FDA, he was there. And so then, he ended up asking after he kind of heard what I would do. And so then he went ahead and had me come and lecture to his group. And other dental groups, no, I haven't, presented to them. I'd be happy to, and just some of the things too, that actually when we were down there, actually when I presented, Sammy brought some of the different materials. And then let's see if I have that right here. When I was, when I presented once, and then I was testing between some of the materials that the titanium, and then to some of the ceramics, like the dental implants and stuff, because he had that. So he brought my equipment, and then we looked at that, and the difference between some, let's see if I can roust them up here or not. The difference between some of those titanium and even titanium and titanium implants. Yeah, here it is. So here is between titanium in the foot. This is a screw I took out of the foot, and then a titanium implant in the mouth. Okay. So let's see if I can get this to show a little bigger. Yeah. So here we are. And it was 394 millivolts between the titanium I had out of the foot and the titanium implant. Okay.
Yeah.
And then I went between that titanium implant and then like a zirconia or a ceramic, you know?
Yeah.
And
yeah, there is no okay.
yeah, 0.1,
Debate.
you know,
Debate.
0.1, yeah, millivolts. So there was, you know, nothing
Comparable.
and
There is
so
nothing comparable.
yeah, yeah. So I mean, you don't have at least the galvanic reaction going on. And when I look at, you know, implants like in the body that we have, and what can cause problems with the implants. Okay, number one, infection, you know. Number two, the implant isn't working properly or it's not aligned properly or what have you. You know, number three, you know, we have an allergy to the implant, okay, an allergy. Or then number four, potential galvanic reaction between the different metals, you know. So
full dental
you know,
revision, you know, it's we are not to talk today about if it's necessary to put implants in mouth, because I think it's another topic. But yeah, you're right. It's I think for those patients who suffer a lot about back pain, fog, energy, and I think you have a better list than mine of symptoms. Starts in the mouth, and like you say, that if you can't change an ankle or a knee or a hip, because it costs also. So just do something in the mouth, and it's a good start. And so.
right.
Thank you, Scott, about your time, your precious time, and for sure, I think we can do something in Switzerland. Do you know Switzerland? Have you been in Switzerland?
I don't, yeah. What is it?
Have you been in Switzerland? Switzerland.
Oh, have I been in Switzerland? Yes. Oh, yeah. Yes, I have. It was back after my first year of my medical training. We had that summer off. So
it was
I
yesterday.
went with my Euro pass and my backpack for a month and a half. So it was it's incredible. Yes.
Yeah. So it will be an honor to invite you in Switzerland and to do perhaps a conference. And also, I truly believe that dental schools, dental trainings need to have a topic about, you know, this is an obligation for me to study about the reactions, because the dentists are, they have the choice to do for aesthetic, but also for the health. And I think that in the biological dentistry, more and more, a lot of dentists are aware about this kind of stuff. So it will be a beautiful connecting dots. So thank you again. And
yes, actually on that point we had when I presented to one of the oral surgeons from Germany who was also presenting, came up to me afterwards, and that was the Sammy's meeting, and he says you need to be presenting that lecture to every dental conference in the world.
Okay.
It's what he said.
You need to duplicate yourself. You need to duplicate yourself.
Right, I just like exactly. So.
Do you have a team, you know, Scott? Do you have a team of people able to, you know, for example, if tomorrow, you know, there is dentist or school dentistry school who wants to be trained about this topic, are you alone, or do you have other people who can train, explain that? Do you have a team?
No, well, I'm working now with some dentists and others, you know, and so, but no, we're just kind of in the initial. I mean, as far as this, no, I'm the only one right now on this that, you know, has all of this type of experience, and just because I've paid attention over the years. And now I'm retired from my clinical practice, so this is my passion, like you say. I mean, because it can help so many people, and it has. And so that's where I'm at. But yeah, so no, it's just kind of me, but I'd be happy to present wherever.
Okay. Okay, perfect. So thank you a lot, and take care about your dogs too, because I see that you have how many dogs too? Two?
Just two.
Just two,
yeah,
okay.
you see it?
There is no implant in them.
No, my previous dog did have implant actually for a knee, and it started, later in life, shaking and all this stuff. And I go, I wonder if it was from that, Anyway, she's passed now, but yeah, I don't know.
Okay, so thank you a lot being present to my Jumping Detox YouTube channel, and I hope that we can meet again in the future.